we talked about the disclaimer, and one of the disclaimers I want to point out is that we've all heard that sitting is the new smoking. So we've been sitting for about an hour. So I'd like everybody, because we're going to talk about exercise, to just stand up right now, okay, and do a bit of a stretch. So stretch up, reach up to the ceiling. Maybe put your hands and just twist and turn. Get the neck feeling better. If you're able to, do some tricep push-ups, do some squats, or stand on your toes. There's research now that even standing tiptoes every 20 minutes will actually reduce insulin sensitivity from one of the Professor Jennas at Professor of Kinesiology at the University of Toronto. So again, just get a little active, do some stretching, and we're going to dive into the role of exercise. And so I'm also trying to work a couple screens. I don't, all right, so we got a little bit of a hiccup here. Yeah, it's actually putting in all my slides that were blocked out earlier. So I hope this doesn't continue because I'll have to keep clicking. So learning objectives today, in the next 15 minutes, I'll be sharing to learn and apply the science of how the brain heals with exercise. Newer approaches, I'll have to leave to the Q&A because we won't have time for that. And we're going to be inspired by patient testimonies as well. Now, this is not a patient, but this is one of the clinical fellows, probably one of my brightest clinical fellows to ever work with me. And he allowed me to share his story today. And hopefully we can bring him back maybe as a future speaker. But back in January of 2013, he was driving in icy weather conditions. He was in the second year of medical school, lost control, smashed into a tree, and look at what happened to him. 3 fractures in the brain, bleeding in the brain. He was in a coma. He had to be intubated. They had to put tubes in his chest just to keep his lungs being able to expand and to basically survive. And he was paralyzed and also had a facial palsy as well with nerve damage. So he was in really bad shape. Now, he managed to survive the acute stabilization at Woodstock Hospital. He was then transferred to Victoria Hospital and then moved on to Sunnybrook. And there he was in a neurosurgical intensive care unit. And after getting medically stabilized, getting extubated, he was then transferred to the Toronto Rehab Institute, where as an inpatient, he had a month of intensive physiotherapy, occupational therapy, speech language therapy. The psychologist worked with him as well, and they really rated him at a low cognitive function level. In fact, he was advised that he probably would not be able to complete medical school. So he was discharged after that, but he wasn't happy with the idea that he was not going to be able to fulfill his dream of being a doctor. So one of the tipping points for him was coming across the research of Dr. John Ratey. John Ratey is considered the grandfather of exercise for the brain. He's an associate clinical professor of psychiatry. His groundmarking book for the public was in 2008 called Spark. And I've been able to go through that book. And one of the things Dr. Ratey says very clearly is exercise is the single best thing you can do for your brain. Do for your brain, for your mood, for your memory, for your learning. So we're going to dive into the science behind that. And we're going to basically, by the way, Dr. Galati did complete medical school. He completed his family practice residency in 2019, before the pandemic, was when he worked with me for a month doing his clinical fellowship. And I'm proud to say that he's now spearheading the Brain Injury Initiative, a nonprofit organization to really help people after their concussions and brain injuries, and really to get the word out, not only on exercise, but also on healthy eating, as we've heard so brilliantly from Dr. Mary Skubertakis, and also the importance of a holistic approach, as we learned from Dr. Perry earlier. So that's Dr. Galati, Matt Galati. Now, why does the brain respond to exercise? There's three scientific terms I'd like to leave with you guys. One is the concept of neuroplasticity. We used to think when I was taught in medical school that once the brain is damaged, that's it. It can't regenerate. There's nothing you can do about it. Like you've had a stroke, that's it. You can't do anything. But we know with the latest science, and especially the imaging studies that we can now do, that there's a concept called neuroplasticity. The brain can change. And I heard a quote that, the brain is like silly putty. Just like Jello, as we saw in one illustration earlier. It's like silly putty, and it will harden over time. But exercise helps to warm the brain. It helps to improve blood flow, circulation, and oxygen. That's a key thing in terms of how exercise will help the brain. It improves blood flow. That's one component. So there's this concept that you need to understand that the brain can change. When it creates new cells, it's called neurogenesis. When it creates new connections, as you can see in this diagram here, that there are little connecting dots there, that's called synaptogenesis. Now, what is the molecule that drives the healing of the brain? This is the second term I'd like you to be aware of, and it's called BDNF, brain-derived neurotrophic factor. This is when they look at all the science, this is the most abundant neurotrophin, or another term for protein messenger in the brain, in the adult brain, that really helps repair the cells. It repairs the connections called the synapses, and it also protects the brain from future damage in the future. If you want to avoid Alzheimer's, you got to do things to elevate your BDNF. And aerobic exercise is probably one of the top things you can do. When you exercise aerobically, BDNF is released from your muscles. BDNF is released from brain cells. It's released from the monocytes, white blood cells in the bloodstream. It's released from the vascular endothelial cells. These are the cells lining your blood vessels in your heart and arteries. This is a key player in terms of helping your brain get better. Googling all this information, you'll learn about one question was, does coffee help? Well, it does help. Chlorogenic acid in coffee helps to elevate BDNF, and we can maybe talk about that in the Q&A as well. The other third thing I want you to know is you want to know the anatomy of the brain. There's two areas that are foundational. And when they've done studies on people with Alzheimer's, the two big areas that shrink as you get older is the prefrontal cortex and the hippocampus. And you can see that on the diagram here. The prefrontal cortex is really what makes us human. The prefrontal cortex is the center for higher executive functioning, for our reasoning, for our problem solving, comprehending things, creativity, being able to persevere when you're exercising, right? And a big one is impulse control, because it sends signals to another center called the amygdala, which is your, it's like Bruce Banner turning into the Incredible Hulk. The amygdala takes over and you've got all this rage and anger. Well, the prefrontal cortex sends signals there to shut down the amygdala, to help you control your negative emotions so you don't become and act like an animal, right? Now, the other big area that tends to shrink with the as we get older, and especially if we get dementia, Parkinson's, is the hippocampus. And that's the squiggly one that you can see sort of near the amygdala. And it's, again, it's the center for learning and memory. This is where, as you read something, as you listen to the talk, you're encoding things. And consolidation retrieval, when you want to recall things, comes from the hippocampus, right? When you're driving a car, your spatial navigation tells you where to go from your hippocampus. It's like your GPS in some ways, right? So you got to protect these two areas of the brain. And Dr. Rady says, your brain is like a flexible muscle. You use it or you'll lose it. So if we don't use our prefrontal cortex, as Dr. Perry talked about, there's puzzles and other things that we can do, we'll lose it. And if we don't engage in activities that can help with our hippocampus, then we will lose it. So I went into Dr. Rady's book in a little more detail because he had some really good quotes. I'll just talk about them briefly. One is on page 227, he says, when people ask me how much exercise I should do for the brain, I tell them the best advice is just to get fit and continue challenging yourself, continue to improve. I mean, if you're not exercising at all, and I hope none of you are like that, but if you're not exercising at all, just start with 5 minutes. If you're doing 5 minutes, do 10 minutes. 10 minutes, just build on that. And if you're just exercising once a week, try to get to daily exercise. Daily exercise ramps up BDNF more rapidly than alternate days. If you look at studies where they actually did measurements of BDNF, which we can't get under OHIP or any labs like that, but in the scientific research studies, if you do daily exercise after 2 weeks, your levels go up 150% rather than exercising every other day. And a part of Dr. Galatti's rehab was he built himself up to be exercising every day and encouraging people to do the same. Now, how do we exercise every day? How do we get the brain better? Well, one is to track your heart rate. I have an Aura ring. I have other devices to track my heart rate, my steps. They say the gold standard is 10,000 steps at 2.5 feet of, like a 2.5 feet per average stride. That would be close to 5 miles. And then you can start off with low intensity walking, but you want to start to increase your intensity. And the studies show, there was a study that came out in September last year, JAMA Neurology, which is well credentialed, and it was from the UK. They looked at over 79,000 healthy adults, average age of 61, followed for almost 7 years. And those who are already walking regularly, the goal was getting close to 10,000 steps. They were actually at 9,800 steps per day. They were doing that already. They were 51% less likely to develop dementia, Alzheimer's at the end of the study. And even those who did maybe 3,000 steps a day, 3,800 steps a day, they were 25% lower. But obviously getting more would be better. And they found that if you can increase the intensity or how fast you walk, that's even better. Brisk walking is better than just slowly walking. So build yourself up with your cardio. And a little is good, as Dr. Rady says, more is better. This is before the studies were published. This is way back in his observations with patients and with the research. He recommended getting the 6 days a week for about 45 minutes to an hour. And on 2 of those days, get some high intensity type of exercise where you can maybe sprint or run for short distances and maybe incorporate some resistance or weight training. 2 days a week. What else do we learn? It's better to exercise with others. There's a serotonin release, and it gives you happiness, what we call the happiness hormone. When you're exercising alone and you've got stress, you could have high cortisol, which will interfere with the development of your prefrontal cortex and your hippocampus. And again, start slow and build up gradually. He was able to get rid of 10 pounds of spare tire around his waist, he mentioned, by incorporating the high intensity type of training as well. And again, there's even research showing that fasting will also help with that, but also will generate higher BDNF as well. So we could talk about in the Q&A as well. Now, if you want to fast forward, that was older research. The latest research that just came out a year ago is a book by Professor Jennifer Heitz, who's at nearby McMaster University. And her book, Move the Body, Heal the Mind. And what I was really impressed, not only by her research, but she also did, for someone who was like never exercised when she was a medical student, she's now completed 2 Ironman competitions. So she really walks the talk. And I really like in her book, she talks about workouts that people can do. So there's 7 different types of workout strategies. Like if you're new to exercise, or if you have an addiction problem, here's what you can do, or attention deficit disorder, here's what you can do. If you have anxiety or depression or a brain issue or concussion, she's got programs in there for that. And I hope, again, this is a great resource to look at as well. Now, just to before we turn things over to Ezra is going to give his testimony, you can take a snapshot of this. This is with the bottom line with all the science. There's references there for heart health, cancer prevention, emotional health, and brain health. The goal to aim for is to get to at least 150 minutes a week. And you do this with the Wii Fit mnemonic. So warm up so you don't get an injury, and by cooling down, maybe doing some stretching. The frequency you want to build up, get to the intensity where you can feel yourself sweating and panting. And the 5 S's, which is sort of the theme of the talk, is the stamina, cardio exercise, strength, weight training 2 times a week, learn about the spine, keeping your core strong, the McGill Big Three that you can research out. And if we have a future session, we could dive into that. What I do when I brush my teeth in the morning is I will balance on one foot as I'm brushing my teeth to get my stability, my balance going. I sort of make little habits of things like that. And the sensory eye-hand coordination is key. I have a friend, a colleague, patient who has Parkinson's, and he's doing something called Rock Steady. So he's joining the boxing classes that my wife and I are doing, because Rock Steady is a whole approach to helping people with Parkinson's to mitigate the progressive deterioration in a person's condition. You want to make it easy, enjoyable. You want to schedule it, and you want to have a competition component, because that really will motivate you. The other thing to do is the 5 Ds to make exercise a lifelong habit. Number 1, make a decision today. You're going to make a decision. I'm going to commit to exercising more, to getting out there. 2, declare it. So declare it to your significant other that you're accountable for. Write it down as a gift to God, that, hey, God, I'm going to look after my temple of my body, which is a gift from you, God. I'm going to look after my body as an act of worship. Date it. Put it in the calendar when you're going to exercise, and schedule it in. And be determined, persist. And doubling up, as it says in Ecclesiastes, 2 are better than 1. Doubling up with someone who can really encourage you and help you with doing some things like that. As Arthur Ashe said, the first one of the lead Afro-American tennis players, he said, start where you are, use what you have, do what you can. And one of the things that's taken off, which is good for eye-hand coordination, that you can also look at, is my 80-year-old mentor, Baha, said, come on, Gord, let's go play pickleball. So I've learned to start to get involved with pickleball as well. That's a great sport to also get the cardio, get the sensory balancing as well, and also get the companionship. One of my former patients, Fauja Singh, back in 2003, set the world record for his age group at the Toronto Waterfront Marathon. He ran the marathon in 5 hours and 40 minutes. So it doesn't matter how old you are, start moving, start training now. And I was really impressed as well by Ron Roberts sharing in the Toronto Star. He said he was diagnosed with Alzheimer's in 2018. And he said, I'm not going to just live with a life sentence like this. I'm going to do something about it. And in Toronto Star 2019, he says, university can be hard. It's even harder when you're 81 and have Alzheimer's. And he said, if you have a problem, you have to adapt. You don't give up. And what I found this year was he graduated from the University of Western Ontario with a Bachelor's of Art, 3-year degree. So congratulations, Ron. You're doing a great job. And I think let's follow his example. Let's not stop. Let's keep going with our brains. So I'd like to maybe now turn things over to Ezra. So I'm going to stop share here. Or maybe Ezra, can you just jump on?
Yeah, hello.
Yep.
Okay, hi everyone. I'm Ezra, a kinesiology student, and today I'll be sharing my personal testimony or experience with brain injury. So just 1 month before I was about to finish grade 11 of high school, I was rear-ended in a car accident that gave me a bad concussion. I had symptoms like headaches, low concentration, low energy, and sensitivity to light and sound. I was told to rest, try out various treatment options, and gradually return to the activities and schooling that I had been in prior to the accident. I ended up taking the following school year off, focusing on recovering as much as possible. Sadly, improvements were minimal, and upon my return to high school that year, I was only successful in finishing one grade 12 course. Sensitivity to light and sound were the hardest symptoms I dealt with. Going to places with bright lights, loud music, or even noisy places like restaurants would worsen my symptoms quickly, triggering headaches and causing me to be in a lot of pain. Using the computer, phone, and reading for extended periods of time would also worsen my headaches. As a result, I went to a lot of doctors and different therapists, but it seemed like every new doctor or therapist I would go to would just be false hope for my condition. I was promised that I would get better soon, but any improvements I had always seemed to hit a wall. I had a lot of trouble adjusting to this new lifestyle. In the early stages, I had to wear a hat everywhere I went to help with light sensitivity and noise-canceling earbuds for noisy places. It felt like I was living in a completely different world from other people. Going back to school was not easy. There was always the worry that my symptoms would worsen during class. To top things off, friends my age had already graduated, so going to school just didn't feel the same as before. I felt worthless and hopeless. Worthless because I had limited function and could not do the activities I'd once enjoyed doing, and hopeless because it seemed like I would never get back to 100%. My faith in God at that time was at an all-time low. I was angry at God and the people around me. Why did God allow this to happen if he claims that he loves me? I wondered why I had to continue living this life if all that was left for me was pain day after day. At that time, I also wished I could have passed away instead of living in suffering. But during those dark times, people from church, family, and friends prayed for me, visited me, and came to encourage me. I was especially encouraged by a brother from my church who shared his story of chronic pain with me. I was in awe at how he could be so joyful and certain that God still loved him despite the sufferings he experienced. He shared that it was only through counting God's blessings that he could still be here today. He also challenged me to pray for others who were sick, reminding me that I was not the only one struggling. As I began to count my blessings and pray for those who were sick, I no longer felt alone in my pain and began to realize more and more that everyone is struggling with something. I had been too focused on my pain that it stopped me from focusing on God and the people around me. It was around then that my heart started to break for those who were hurting. I began to want to care for others. I was also greatly encouraged by verses in the Bible. To me, it seemed like they had come to life during this injury. Answers like why I had to experience this came to me through verses I previously memorized from one of the youth ministries I attended at church called Bible quizzing. 2 Corinthians 1 verse 3-4 reads, "Praise be to the God and Father of our Lord Jesus Christ, the Father of compassion and the God of all comfort, who comforts us in all our troubles, so that we can comfort those in any trouble with the comfort we ourselves receive from God. My pain would not be wasted. Instead, the comfort I received from God during my pain could one day be a source of comfort for others." 2 Corinthians 4 verse 16-17 reminds me that God has a purpose for my pain, that it would develop my inward character. It reads, "Therefore we do not lose heart. Though outwardly we are wasting away, yet inwardly we are being renewed day by day, for our light and momentary troubles are achieving for us an eternal glory that far outweighs them all." This was one turning point in my journey to recovery. The second came through finding good therapy throughout the years. Treatments that I found that gave me the most improvement came from chiropractic functional neurology and physical therapy. It was there that I was taught different exercises and stretches to help reduce and manage my symptoms. The hard part was doing these exercises and stretches while being very symptomatic. Through gradual incorporation of these routines, I began to regain more function and become less and less symptomatic. I began to have better endurance for reading and studying, being able to play sports again, and going out for a jog. And fast forward to today, I'm close to achieving a full course load as a university student. There were also times when I tried to do too much. Instead of gradual increase of activity, I increased too much at once, which resulted in some setbacks. There is no rush. Take your time, do the best you can at your current condition, and slowly but surely, things will get better. As I conclude my sharing, I want to leave behind two thoughts. Number one, remember that everyone is struggling in some shape or form. While people may appear to be happy or live a good life, there is a hidden battle that everyone is facing. So be kind and remember to pray for others. Number two, don't focus on your circumstance. Focus on God. I had been blinded by my pain. I believed that how I felt defined truth, but the reality is that God's word is truth. So count your blessings. Look back at how faithful God has been in your life. Despite how you feel, God still sees you and cares for you. Thank you for listening. To God be the glory.
Thanks so much, Ezra, for sharing your story. And I think God's going to be guiding you on a path where what's happened to you is going to open doors in terms of how you can help others, especially when you go through kinesiology training. Hopefully connect with Professor Heitz at McMaster and get help out with the research and really move future generations to better brain health. So thank you very much. So, I mean, Hippocrates basically had said back in 400 BC, the father of Western medicine, walking is man's best medicine. And, if you are in a bad mood, go for a walk. And if you're still in another bad mood, go for another walk. The father of back pain, again, Professor Stuart McGill from the University of Waterloo, said walking is non-negotiable for back spine health. And we now know from the latest research that came out a year ago, last September, that we want to get the 98,000 or 10,000 steps a day which is the optimal dose to really lower significantly the risk of all-cause dementia. Right? That's Dr. Borja del Pozo Cruz in JAMA Neurology. In the Bible, we've heard the biblical, wisdom from the past. Also in the Bible, we learn of biblical wisdom in Hebrews that the discipline of exercise, exercise being one of the disciplines, it doesn't seem pleasant at the time, and it may be even painful. But later on, however, it produces a harvest of righteousness and peace for those who've been trained by it. And interestingly, the author of Hebrews talks about strengthening your feeble arms. So do your push-ups, do your weight strengthening, and do your squats to strengthen your knees as well. So again, let's get into the exercise component. Brisk walking definitely prevents Alzheimer's. There's studies that have come out for this 2 years ago. And again, the data is building up from Dr. Rady's type of work. And again, this is the research that was published in JAMA Neurology that I've been quoting. To the two top guys that you should really follow on the internet when it comes to dementia is neurologist, one from Naples, Florida, Dr. David Perlmutter. He's an associate professor down at the University of Miami. And Dr. Dale Bredesen, who's a professor at UCLA. And I like the neuro concept that David Perlmutter shared. You've got to look at nutrition, exercise, which we talked about, and unwinding stress management, restorative sleep, and optimizing cognitive activity. Perlmutter was the first actually to publish years ago, 2014, you can reverse Alzheimer's, mild to moderate Alzheimer's case study. That was 2014. He said, these are the 9 things to do. We won't have time to go into that. Now it's been followed by a study that just came out last year, where it was a pilot study looking at about 60 patients, I think, or 25 patients that was followed over 9 months. And the best drug for Alzheimer's will slow the decline of the disease by 32%. Using a precision medicine model that Bredesen is teaching, 84% of patients improved. They actually reversed their cognitive decline, right? So, and he's now in the process of setting up a randomized controlled trial, which is sort of the gold standard to really prove that these types of approaches work. I want to just finish with that. And again, there's a lot of really exciting research that is incorporating things that will transform the landscape for not just Alzheimer's, but really for our brains in any kind of issue, right? And Desmond Tutu said there comes a point where we need to stop pulling people out of the river. That's like, oh, you've got severe dementia. We got to put you in a nursing home. We got to feed you or whatever. We need to go upstream and find out why they're falling in. And this is where the precision medicine model comes in, the functional medicine model. And John F. Kennedy said, the time to repair the roof